Here's a look at your health headlines on Medwatch today. How many of you are traveling abroad this summer? You might want to check in with your doctor first. A new study shows people traveling abroad may not be getting the right vaccinations. In fact, between 2009 and 2014, more than half of international travelers who were eligible to receive the measles, mumps, and rubella vaccines did not. Ask your doctor about other infections that you might be at risk of around the world, including hepatitis A, yellow fever, and malaria. For a link to check health notices based on your travel destination, head to medwatchtoday.com. If you're having trouble sleeping at night, the best cure may be a bit of exercise. New studies show that a dose of physical activity during the day helped those suffering from both insomnia and sleep apnea. One study showed that exercise alone led to a 25% reduction in those symptoms over a 3-month period. We talked to the folks at Community Regional's Fitness Center. They recommend getting 2.5 hours of aerobic exercise each week, along with a couple sessions of strength or resistance training. They say go for a moderate intensity, meaning you can still talk, but have to catch your breath every few sentences. And finally, here's something just about everyone can agree on. Chocolate is delicious. And now there's another good reason to eat it. Researchers tracked more than 55,000 people between the ages of 50 and 64 and found that chocolate eaters had a reduced risk of irregular heartbeat. And the risk went down the more often chocolate was consumed. They give the credit to the cocoa's antioxidants called flavonoids. Of course, you can't go overboard here. Each serving should be no more than an ounce, and it should be dark chocolate, not milk. Part of what makes community medical centers so special is the staff. Each week we feature a healthcare hero, someone who demonstrates what it means to go above and beyond for each patient every day. This week we'd like to introduce you to Jamie Shively. She's the RN House Supervisor at Community Behavioral Health Center. Her job is to oversee staff and make sure they're set up to effectively serve each patient's needs. Jamie says she works to put a focus on the patients and enjoys interacting with them while coordinating support resources both in and outside of the hospital. Shively's been here for 10 years and says it's nice to be able to come to work and be proud of what she does.
I try very much to see where the patient's coming from. I am constantly trying to put myself in the patient's place, what their history is, where they've been, what kind of symptoms they're suffering from, and try to think of what that would look like for me, and then in that case, what would I need?
Shively actually started as an oncology nurse, but after being offered a job at a psych facility working with teens, she never looked back. She says it feels like what nursing was always meant to be. Even more, Community Medical Centers is hiring. Our job of the week is looking for a registered nurse for the VAD program at Community Regional. This person is responsible for the coordination of inpatient and outpatient care for patients with a ventricular assist device, or VAD. To see a list of qualifications needed and application information, check out jobs.communitymedical.org. Still to come on Medwatch today, the surgery that's getting one woman back on her feet, literally. A closer look at knee replacement surgery. And we'll head into the kitchen with the chef from Clovis Community Medical Center. He's got a healthy, summer-ready dish ready to share.